Hypertension by Kirsten
and Cara.
For your daily checkup?
Oh,
Yes. So I've been reviewing your chart and I saw that your blood pressure's been on the rise for the past few years.
Oh, dear.
Yeah, and so I was just wondering if you would be able to tell me kind of your daily routine.
Well, let me think. Well, I guess my day starts with a little bit of Bailey's in my coffee. And then my gosh darn dog always seems to run away, so I have to chase after him. So I give myself a little shot of nicotine to give me that boost I need. And then I always add a little bit of salt to everything I eat. Just a little bit though, you know?
Okay, so your blood pressure is 145 on 95.
Okay.
That is a little bit high for somebody your age, so I'll review with you what is the normal blood pressure.
Okay.
Okay, so low risk blood pressure or normal blood pressure is 120 on 80. Medium risk for hypertension or on your way to developing hypertension is 140 over 90. High risk hypertension or full hypertension is when your blood pressure is 160 and above over 100.
So, and have you been having a headache or feeling very tired, any chest pain recently?
Well, I get a little bit of a headache, but nothing too extreme.
Okay, so those could be some symptoms of hypertension.
Oh.
But if you don't mind, I'm just going to go over with you some of the pathophysiology about why hypertension occurs in your body.
Okay.
Mean arterial blood pressure is proportional to cardiac output multiplied by resistance. Cardiac output is stroke volume multiplied by heart rate, or the volume of blood leaving the heart per minute. Stroke volume is the volume of blood leaving the heart each time it contracts. Heart rate is the number of beats per minute. Ultimately, blood pressure is regulated by heart rate, blood volume, resistance, and strength of contraction, all of which aim to maintain homeostasis. As previously mentioned, heart rate is the number of beats per minute. This is controlled by two components of the autonomic nervous system, sympathetic and parasympathetic. In the parasympathetic nervous system, the neurotransmitter, ACH, targets the muscarinic protein receptor located on the cell membrane of the cardiac muscle, resulting in a decreased heart rate and ultimately a decreased blood pressure. In the sympathetic nervous system, the neurotransmitter, norepinephrine, targets the beta-1 protein receptor on the cell membrane of the cardiac muscle, causing an increase in heart rate and ultimately an increase in blood pressure. The sympathetic nervous system not only increases heart rate, but strength of contraction.
Strength of contraction directly influences stroke volume because a stronger contraction would result in more blood leaving the heart per beat, whereas a weaker contraction would result in less blood leaving the heart per beat. Another influential factor to blood pressure is blood volume. The renin-angiotensin-aldosterone mechanism utilizes two hormones that increase blood pressure, ADH and aldosterone. When renin is released from the kidneys, it converts angiotensin into angiotensin 1. Angiotensin 1 goes to the lungs, where it is converted into angiotensin 2. Angiotensin 2 triggers the adrenal cortex to secrete aldosterone, which increases absorption of sodium by the kidneys. When sodium is absorbed, water follows, resulting in increased blood volume and ultimately increased blood pressure. Angiotensin 2 also triggers the pituitary to release more ADH. ADH reabsorbs water into the kidneys, causing an increase in blood volume and ultimately an increase in blood pressure. The last component of blood pressure regulation that we will discuss is resistance. There are three main factors that influence resistance: diameter, this is the one that the body is most likely to alter, viscosity, and length of blood vessels. The last two, the body is less likely to alter.
Diameter is altered by the sympathetic nervous system. When the neurotransmitter, norepinephrine, binds to the protein receptor alpha-1, the smooth muscle surrounding the blood vessel contracts, thus increasing resistance due to decreased blood vessel diameter. This is the number one way of altering blood pressure.
In order to regulate blood pressure, neurotransmitters are released from the second synapse in the autonomic nervous system. Neurotransmitters bind to the receptors, which are composed of proteins and located on the cardiac muscle cell membrane, to ultimately increase or decrease blood pressure.
Blood pressure is maintained through homeostasis. When there is an imbalance, the baroreceptors detect it. The baroreceptors then send impulses to an area of the brain called the medulla. The medulla becomes aware that homeostasis is disturbed by the amount of impulses it receives from the baroreceptors. In an effort to maintain homeostasis, the medulla stimulates the appropriate autonomic nervous system function. For example, if blood pressure was too high, it would stimulate the sympathetic nervous system to turn off and then turn on the parasympathetic nervous system to decrease heart rate, ultimately decreasing blood pressure.
So, Edna, does that all make sense to you?
Oh yes, thank you, dearie.
You're welcome.